A specific curette is semicircular in cross-section. It has a rounded back and toe. This design allows it to be used both supragingivally and subgingivally. An area-specific curette has only one cutting edge per working end. The face is tilted at approximately a 70-degree angle to the lower shank. The curette has curved cutting edges and a rounded toe that enhance adaptation to rounded tooth surfaces and root concavities. An important difference among the sickle scalar, universal curette, and area-specific curette is the relationship of the face to the lower shank. The face of a sickle scalar or universal curette is at a 90-degree angle to the lower shank. The cutting edges on these instruments are level. The face of an area-specific curette is tilted in relation to the lower shank. The tilted face causes one cutting edge to be lower than the other edge on each working end. The lower cutting edge of an area-specific curette is automatically at the correct angulation when the lower shank is parallel to the tooth surface to be instrumented. First, select the correct working end. Use a tooth that is easily seen, such as the first premolar. Establish a finger rest and randomly place one of the working ends on the distal surface. Study this working end. Note that the lower shank is not parallel to the distal surface. Also, the functional shank is down and around the tooth. This is the incorrect working end. Look at the opposite working end. Note that the lower shank is parallel to the distal surface and the functional shank goes up and over the tooth. This is the correct working end. Establish a finger rest and get ready for insertion. Turn the toe of the working end toward the distal surface, as this is the direction in which you will be working. Place the working end in the Get Ready zone at the distofacial line angle in the middle third of the crown. Prepare for insertion by lowering the instrument handle to establish a 0-degree angulation. Gently slide the working end beneath the gingival margin and onto the distal surface of the root. Adapt the toe third of the working end to the distal surface of the root. Imagine that you are locking the toe third against the tooth surface. Move the instrument at least halfway across the distal surface. Remove the curette from the pocket in preparation for the facial surface. Place the working end in the Get Ready zone. Lower the instrument handle and gently slide the working end beneath the gingival margin. Imagine the face sliding along the facial surface all the way to the base of the pocket. Reposition the lower shank and make controlled strokes across the facial surface. Be sure that each upward stroke is distinct and that you pause slightly to relax your grasp and slide the working end back to the base of the pocket. As you approach the mesiofacial line angle, roll the handle slightly to maintain adaptation. Keep the toe third locked against the tooth surface during all instrumentation strokes. Make sure that your strokes extend past the midline of the mesial proximal surface. Use of horizontal strokes. Horizontal strokes are extremely effective in removing calculus near the distofacial and distolingual line angles of posterior teeth and the midlines of anterior teeth. Insert the curette slightly distal to the distofacial line angle. Lower the instrument handle until the curette working end is oriented with the toe toward, but not touching, the base of the sulcus or pocket. Begin a calculus removal stroke slightly distal to the distofacial line angle. Make several short, controlled strokes around the distofacial line angle. After completing several strokes, reposition the curette to continue making oblique strokes across the facial surface. Lower the handle until the curette toe is toward, but not touching, the base of the sulcus. Make several short, controlled horizontal strokes across the midline of the facial or lingual surface. Practice selecting the correct working end for the mesial surface of the central incisor. Place one of the working ends against the midline of the facial surface. Carefully look at the working end. If the instrument face tilts slightly away from the tooth surface, you have selected the wrong working end. If the instrument face tilts toward the tooth surface so that the face is partially hidden, you have selected the correct working end. For this technique practice, work on the mesial surface of the mandibular right central incisor. Aim the toe of the working end toward the mesial surface, as this is the direction in which you will be working. Place the working end in the Get Ready zone. Gently slide the working end beneath the gingival margin to the base of the pocket. Adapt the toe third of the cutting edge to the tooth surface. Imagine that you are locking the toe third against the root surface. Make controlled strokes across the facial surface. As you approach the mesiofacial line angle, roll the instrument handle to maintain adaptation of the toe third of the working end. Continue strokes until you work at least halfway across the mesial surface.
I'm coming in from a 7 to 8 o'clock position to demonstrate the use of an anterior Gracie on the anterior sextant. I have a Gracie 5-6. This will also apply for a Gracie 1-2 or a 3-4. You want to make sure that the lower shank is parallel to the surface you're scaling. In this instance, it's the mesial of the lower left central. Look at the cutting edge. You want to make sure that you have the lower cutting edge of the two curves on this Gracie blade. It's the larger curvature, or the blade or the cutting edge that's furthest away from the handle that I want to adapt to this mesial surface. Now I'm going to flip this instrument over right now to show you the wrong end of this blade, or this Gracie. And here you see that if you look at the cutting edge very closely, you can see that it is the lower cutting edge, the one that's furthest away from the handle, that is going to be against the tissue in this instance. So if I upright the lower shank and make it parallel, the cutting edge, the lower cutting edge, is going to traumatize the tissue. So this is the incorrect end. Now I have the correct end, and let me just show you on a couple of teeth here how this is used. We start toward the facial and then rotate around into the mesial. Keep the lower shank as parallel as you can and rotate on your fulcrum to make the stroke. I'm going to do the next tooth. So this end will scale the surfaces toward me, or toward your body. Here's an extreme close-up of the Gracie 5-6 curette. I'm going to demonstrate how you insert this blade and establish angulation on an anterior tooth. So we'll close it up a little bit, and then if the pocket is shallow, you're going to come up and upright your lower shank here, and you'll be working mainly on the enamel here as you do overlapping strokes across the surface and up to the contact. Now, if the pocket is deeper, you're going to close this up and ease it down, feeling for the base of the pocket. And then when you stop against something resilient here, like a rubber band, the bottom of the pocket, you're going to lift up your handle and shank so the shank is parallel to the long axis of the tooth, well, actually parallel to the root surface that you're scaling. And then you see you can start strokes at open working angulation, and you can do it at different levels here. You're going to have to do several passes and keep overlapping your strokes until you feel the calculus come off or feel a lack of a resistance until you go up to the top here. Now let's look at this on another tooth to look at the angulation. We're going to close this down and then upright the shank so it's parallel to the surface we're scaling. Now we are at 70-degree angulation, and we can do a series of strokes across and overlapping strokes up to the contact area. We close this up if the tissue's tight, but if the tissue's loose, you stay down, and then you can keep your angulation fairly open as you work your way up to the contact point. I've got a Gracie 5-6 here. You might have a 1-2 or a 3-4. Hold it with a modified pen grasp and establish your fulcrum on the premolars over here on the left side. And then we'll start on the facial of the canine with overlapping short strokes, and we'll go around to the mesial. Now we'll go to the next tooth, and if we can come in and get a close-up, a closer look at this, you'll see that sometimes the embrasures are really tight, and if you're getting stuck, or if there's not a lot of disease here, if the pupil is fairly healthy, you can close your Gracie blade up like this as you come to the contact. Now, if there's more inflammation and calculus, you want to make sure when you rotate around to the proximal surface here that you upright your handle and shank, because that will give you perfect 70-degree working angulation for calculus removal. Do the next one, facial, rotate around, and again, keep your lower shank really upright and parallel with the surface that you're scaling. Now we'll go to the lateral on the left side. You see how I rotate that very carefully with my thumb, and my thumb is in control of this by coming to this front position, and I would be at about 9 o'clock with the patient turned toward me, or 7 to 8 o'clock, and we make sure that the thumb is in control now as we do all the way to the distal of the right canine. Now I've moved to a back position to do the surfaces away. So this is the other end of the anterior Gracie. Make sure that you have the lower shank parallel, and now if we can get a close-up of this blade, again make sure that you flip the instrument and you have the end of the instrument where the lower cutting edge, the larger lower cutting edge, is going to be against the distal surface of this central. You don't want the wrong end. This is the wrong end, and the wrong end would have that larger curvature, or the lower cutting edge. If you place it here on this tooth, it would be against the tissue and it would traumatize the papilla there. Okay, so I'm going to flip this over. I know I have the correct end to do the surfaces away. So let me do the other half of this tooth, because we already did the surface toward us. So now we're doing the surface away, and then we'll do another one. With this other end of the anterior Gracie, we're doing the surfaces away. Here's an extreme close-up of the Gracie 5-6 doing the surfaces away from me. I'm going to close the blade up, go subgingivally, and then upright the handle and shank to get parallel with the surface I'm scaling. Then I'm going to do a series of overlapping strokes across the mesial surface here. And then if the pocket's deep or there's a lot of calculus, I'm going to make several passes with these very short, powerful strokes. And as I get up to the contact point, I may have to close the blade down as I get to the contact. Let's do another tooth. Close the blade down and go subgingivally. Now upright the instrument so that the lower shank is really parallel to the surface you're scaling, and then do a series of overlapping short strokes across the surface, and then I'll go at a different level. Again, these are very powerful short 1 millimeter, maybe 2 millimeter strokes at the most for calculus removal. And then when we get up to the contact, we're going to close the blade down. Now, if you have very little calculus, or you have you just need to deplaque in this area, you insert, upright the blade a little bit, and if the tissue's very tight, you may wish to keep the blade a little more closed here, and then you can do longer, lighter strokes. These would be deplaquing strokes or root planing strokes that are longer and lighter up to the contact point. Now I'm in a back position, and I'm going to come in with the anterior Gracie. This is a Gracie 5-6, but remember you could use a 1-2 or a 3-4. And I'm going to scale the surfaces away. And these are, starting on the lower right canine, I'm going to start toward the facial, scale the mesial of the right canine, and then go on to the lateral, overlapping, short overlapping strokes, and we'll go to the next tooth, and so forth. So you're rotating very slightly on your fulcrum to do this. All the way to the distal of the left canine. Now I'm going to demonstrate the Gracie 7/8 on the buccal surface. I have a modified pen grasp, an intraoral fulcrum here on the occlusal surfaces, and make sure that you have the correct end of this instrument by looking at these visual cues. You want the end of the blade or the instrument that is pointing toward the mesial with the blade curved in toward the crown of the tooth. Also, if you look at the blade, there are two curves on this blade, and it's the larger outer curvature that you want against the tooth. It's also called the lower cutting edge. It's the cutting edge that's furthest away from the handle. If I have the incorrect end, and I'm flipping this over so you can see the wrong end, when I place this with the blade pointing toward the mesial, I can easily see that the cutting edge, the lower cutting edge here, the larger curvature cutting edge, is out against the tissue, and if I scale with this, I would cause tissue trauma. So I'm going to turn this over again, establish my fulcrum, and starting at the distal line angle, I'm going to do a series of oblique strokes across the buccal, and as I get to the mesial, I'm going to use my thumb to rotate this in a little bit to protect the tissue, and then I'm going to stop. So this is only used on the buccal surfaces and on the lingual surfaces, but we'll just demonstrate a couple of surfaces here so you'll understand the Gracie 7/8. Here's a close-up of the Gracie 7/8. We'll insert near the distal line angle and then use overlapping, very close strokes across the buccal and stop at the mesial line angle. We'll take it out and then reinsert on the next tooth near the distal buccal line angle. Use a series of overlapping strokes across the buccal, and then rotate your handle and your blade in toward the tooth, but stop at the mesial line angle. Do all of the buccals in this area. We'll do all the buccal surfaces like this with oblique strokes. Now I'm going to show you how to do the final distal buccal line angle strokes for the mandibular right sextant. I'm taking the Gracie 7/8 and using it toe down right at the disto-buccal line angle, and we're doing very short strokes. These are little overlapping 1 millimeter strokes just at the disto-buccal line angle. We're going to do each of these molars, and this is to pick up any residual calculus at the disto-buccal line angle. Because remember, we've used our 13-14, and then we switched right here to a 7/8 or an 11-12, and a lot of times you'll miss the calculus right in this spot. Our final strokes with the Gracie curettes on this sextant are the disto-buccal line angle strokes. I'm using a Gracie 7/8 here, toe up, and doing short overlapping horizontal strokes, and you can go up and down the line angle here, and this will remove any residual calculus that was left here after you scale the distal and then the buccal. We'll do the last tooth here, so do a series of horizontal, very short strokes just to pick up the line angle calculus on this sextant. To use the 11-12 on the mesial surfaces, first place the 11-12 blade on the mesial of a second molar. You'll notice that when the lower shank is parallel to the surface you're scaling, the mesial surface, the V, or this bend in the shank, is pointing toward the back of the mouth. If you look at the blade carefully, rotate this around, there are two curvatures to a Gracie blade. with all Gracies, the larger outer curvature is the one you want against the tooth. It's also the cutting edge that's furthest away from the handle when you upright the handle and the shank. So let's place that again. You see that the V or the bend is pointing toward the back of the mouth. Now, let's look at this because the bend is not as acute or as obvious as a Gracie 1314. When you place it in the wrong position against the mesial, you'll see that this bend, the slight bend, is pointing toward the front of the mouth. Also, that larger outer curvature is against the tissue instead of against the tooth. If you were to insert this subgingivally and try to scale, you'll traumatize the papilla. So this is the wrong end of the instrument. I'm going to turn this over now, and let's place it, practice it on the first molar. Insert at the mesial line angle, make sure the lower shank is parallel. Now actually you want to lift the handle up and close this blade up if you insert it subgingivally like this, and then open the angle up to be parallel to the mesial surface, and you activate the stroke by rocking back on your fulcrum like this, and that gives you a stroke, and do overlapping strokes up to the contact point. If you don't have a Gracie 7/8, you can use this 11/12 starting at the distal line angle to do the buccal surface, rotate with your thumb to adapt it, and lift up the handle to adapt it to the mesial and do the mesial surface. Let's do the next tooth. Do oblique strokes on the buccal. Use your thumb to roll the instrument at the line angle and rock back on your fulcrum. Use your thumb to keep this adapted against the tooth. Do the first molar, buccal, oblique strokes. Start rolling with your thumb now, and then you're going to be resting on the side of your middle finger for resistance to make the strokes. Here's an extreme close-up of the 11/12 on these mesial surfaces. We'll start at the mesial line angle and insert this on the mesial. Lift up a little bit to make sure that your lower shank is parallel with the mesial surface, and then we'll do a series of overlapping strokes on the mesial, cross the mesial, and then go up to the contact point. We'll do another mesial here. We'll enter at the line angle, adapt, so make sure that this lower shank is parallel to the mesial surface, and then do overlapping strokes across the mesial. We can also use this instrument to do the buccal surface as well, doing oblique strokes across the buccal, and then rotate the tip and complete the scaling of the mesial surface. We'll do the next tooth, adapt at the distal line angle, do a series of oblique strokes across the buccal, then rotate around and finish doing the mesial surface, making sure that the lower shank is parallel with the mesial surface as you advance across to the contact point. Now I'm going to demonstrate the Gracie 7/8 on the buccal surfaces. We'll start on the last molar. This is a little bit of a wrist rock, and it's also a little bit of a finger pull or finger flexing stroke. We'll do the first molar. And when you get to the first premolar here, you can choke up on the instrument even a little bit more and finish up with the buccal of the first premolar. Now, it's difficult to do this stroke because you really have to do almost complete finger flexing to activate the stroke. So I'm going to show you the extraoral rest now. You use an extended grasp. Your thumb is going to be down closer to the middle of the handle here, a third of the way to halfway down the handle, and you're going to rest with these 3 fingers against the mandible. We're going to start on the last molar. Your thumb is adapting this to the buccal surface, and you're using a series of strokes across the buccal surface of each of these molars. You're resting very firmly with the back of your hand against the mandible. Stop before you get to the line angle, and then do just a few strokes here on the buccal. Now, at this point, if you would like to, on the premolars, if this feels like it's too far a reach, you can choke up and then go back to your intraoral in order to do the oblique strokes on the premolars with the 7/8. Here's a close-up of the 7/8 on the buccal. We're going to insert at the buccal line angle, the distal buccal line angle, do a series of overlapping short strokes. These are diagonal or oblique strokes across the buccal to the mesial line angle. Let's do another tooth. Insert at the distal buccal line angle. Do a series of short overlapping diagonal strokes, and use a little pressure with your thumb to rotate this blade or keep it on the tooth as you approach the mesial line angle, and then stop there. Now we're going to do the mesials for this maxillary right side with the 1112 Gracie. And when I start on this last molar, we're going to run into that same problem again. It's very difficult to insert this deeply at all. This is basically a supragingival stroke because you can't get very deeply here. Now, this one's not so bad. I can go a little bit more deeply, but notice how I'm pumping my fingers. I have to finger flex to make this stroke work. Now, if I wrist rock in order to make the 1112 work, what happens is it starts out at good angulation, and then at the end of the stroke, the blade closes down, and that tends to burnish the calculus. So you can, on the premolars, you can do it a little more easily. You can do a partial wrist rock, a little bit of a finger pull. The intraoral rest works best on the premolars, but it's very difficult on the molars. So for the molars, I'm going to show you the extraoral rest. Hold the instrument down further on the handle, rest these fingers on the mandible, and we're going to line this up with the mesial, and you'll see immediately that when you use this extraoral rest, you're able to extend much more deeply and keep the angulation, because you can keep the lower shank parallel to the mesial surface, and then you simply move very slightly against the backs of your fingers, and you can make longer, more even pressured strokes on the mesial as you approach the front of the mouth here, and just keep moving your fulcrum as you go until you finish the mesial of the first premolar. Here's a close-up of the Gracie 1112 on the mesial. Adapt this and make sure that the lower shank is parallel with the mesial surface. Do a series of overlapping strokes across the mesial surface. Come out, adapt to the next mesial, and start at the line angle, adapt, keep the lower shank really parallel, and do a series of overlapping strokes, advancing 1 millimeter at a time as you go across the mesial surface. Come all the way down to the contact point with your strokes. The 1112 can also be used like this on the buccal and the mesial. If you are not using a Gracie 7/8, you can use the 1112 like this to do overlapping oblique strokes across the buccal, and then rotate your blade as you get to the mesial and do both the buccal and the mesial with the 1112 Gracie. I'm doing this with an extraoral rest, but you can also do it with your intraoral rest as well. Here's a close-up of the Gracie 1112. We'll close the blade up to enter subgingivally, and then move your shank forward and your handle so that you can get good working angulation with the lower shank parallel to the mesial surface, and then we do overlapping strokes across the mesial. Let's do the next tooth. Enter, make sure you're parallel, and then do overlapping strokes like this across the mesial surface. Now we can use this 11-12 also to do the buccal surfaces. When we use it that way, we use it starting at the line angle. We do overlapping strokes across the buccal surface, and then we rotate around the line angle here and continue to do the mesial overlapping strokes. Let's do the next tooth. You adapt to the distal line angle area here, and then we do overlapping buccal strokes, rotate around, and do overlapping strokes on the mesial. We'll do one more tooth. We do the buccal, rotate around with your thumb, adapt to the mesial, keep the lower shank parallel to the mesial, and come down to the contact, and continue practicing on all of these teeth in this sextant. Now I'm going to show you the final finishing strokes for the disto-buccal line angles of this maxillary right posterior sextant. So I have a Gracie 7/8, and I'm using a buccal fulcrum here, coming in from a 9 o'clock position, and I'm going to start on the distal and use a series of short overlapping strokes to pick up any residual calculus or biofilm at the disto-buccal line angle. Let's do it on the molar here. Now, this 7/8 adapts better down low near the CEJ or on the crown, but as you go up the tooth, you really have to manipulate or lift the handle to keep this adapted to the root. Let's do the second molar. Just do the disto-buccal line angle here. I'm not going very deeply right now as I demonstrate this to show you that this 7/8 is pretty straight. Now, if I have a deeper pocket in this area, I'm definitely going to use the Gracie 13-14 for this purpose. I'm going to find the larger outer curvature and then adapt that to this distal line angle. Now, right now I have an occlusal fulcrum here, just because that's a little easier, but you might have a buccal fulcrum and then sort of reach back like this with the 13-14. You see how the curvature of this 13-14 allows you to really adapt into the distal and then around the line angle, and even if I go up into a deeper pocket here, this end adapts very nicely. Now, make sure you're not using this end. This is the end that you need for scaling the distal surface, but if you just turn it toe up like this, it's too curved. The inner curvature will not adapt to the disto-buccal line angle. You have to turn it end for end, use this end, which is the wrong end for scaling, but the correct larger outer curvature here is the cutting edge that you would want for the distal line angles. So practice this for the entire sextant and then move on. I'm going to demonstrate the use of the Gracie 13-14 on one posterior tooth. Use your modified pen grasp with the index finger straight and rest the instrument handle and shank junction here on the side of your middle finger. Establish your ring finger fulcrum, and we're going to look at several different cues here, visual cues, to determine the correct end of the 13-14. First, make sure the lower shank is parallel to the distal surface, and then make sure that this bend in the Gracie shank is pointing toward the distal. Also look at the blade. When you look at the blade, there are two cutting edges and they are curved. The blade is curved. It's the larger outer curvature that you want against the tooth. Also, when you hold this lower shank parallel, you can see that the lower cutting edge, or the one that is furthest away from the handle, is the one that you want against the tooth. Close your angulation up by lowering the handle a bit, and then insert this subgingivally, pretend to insert subgingivally, and then lift your handle up to open the angulation. When the lower shank is parallel to the distal surface, you have perfect working angulation with this Gracie curette, about 70 to 80 degrees. And now I'm going to start activating vertical strokes by rocking back on the fulcrum. I'm applying pressure and leading with the first few millimeters of this blade and doing overlapping strokes on the distal. Here's an extreme close-up of the Gracie 1314 curette. We're going to close the blade down and insert subgingivally and then lift up to get the lower shank really parallel with the distal surface. And then we'll do a series of overlapping strokes across the distal. We'll do the next tooth, close the blade up, go down, and then lift up a little bit here. Lift your handle, lift the shank so that your lower shank is really parallel with the distal surface that you're scaling. Do a series of strokes across the distal surface and up to the contact. Now, we can see this really well on the premolar here. Close the blade up, insert subgingivally. This would be a moderately deep pocket. And then once you lift up, you're able to do overlapping strokes with this blade across the distal surface. Now, if you do this, if you insert this and you lean the shank away from the tooth as you make the strokes, you see the point or the toe of this is going up toward the contact, and you would miss calculus down at the base of the pocket. So this is why we need to upright the shank, make sure that it's parallel with the distal surface and parallel with the long axis of the tooth, so the tip of the instrument will go down to the base of the pocket as we are scaling and doing overlapping strokes going up to the contact. To scale the maxillary right sextant with the Gracies, we're going to establish a mirror fulcrum here and retract the cheek. I'm going to take that away and then show you how to use the Gracie 1314 first. Using your modified pen grasp, I'm going to show you first an intraoral fulcrum. When you use the 1314 on the molars, you'll see that it's very difficult to go very deeply. I'm basically using my fingers to use sort of a finger flexing motion to pull this blade down. I'm making sure that the lower shank is parallel to the distal surface. Now, some people will use more of a wrist rock, but if you do this on the distal with the Gracie 1314, you have a very short arc of movement, and again, you can't scale very deeply on these distal surfaces. Now, that may be all right if the patient doesn't have pocket depth here, but this intraoral fulcrum pretty much commits you to a finger flexing stroke or a short wrist rock like this, and it's not a really effective stroke for calculus removal because your fingers are going to tire. It's very difficult to get the pressure and the adaptation that you need in a longer, deeper stroke. So I'm going to use an extraoral rest here. You have to use an extended grasp and use the backs of your fingers. I'm going to rest this now on the mandibular area of the chin. And now I can adapt this 1314 to the distal surface, and you see I'm leaning into it with these fingers. The middle and the ring finger are leaning the blade into the tooth, and then I simply move the whole hand very slightly on the chin to bring the blade down. I can keep the blade very parallel and make these strokes on the distal with the 1314, and I can extend much more deeply and keep the lower shank parallel as I do the distal strokes. Here's the Gracie 1314. We're going to adapt it to the distal surface and close the blade up a little bit, go subgingivally, and then we're going to drop the handle of this instrument so the lower shank is parallel with the distal surface, and then we can do overlapping strokes across the distal surface. Let's go to the next tooth. Adapt this again to the distal, insert, and then drop the handle a bit to get really parallel with the distal surface, and then we do a series of strokes on the distal, overlapping strokes all the way across toward the lingual side. Here's an alternative Gracie curette to use for the distobuccal line angle stroke. This is a 1314 Gracie. I'm using the other end of the Gracie. This is not the end that you usually use to scale the distal surface. I've got this going toe up into the pocket area. If it's shallow, you would just use it here probably to the CEJ to remove calculus that's residual at the CEJ or on the distobuccal line angle on the crown. But if it's a deeper pocket, this orientation of the Gracie 1314 will allow you to go deeper into a pocket, so you could scale in a deep area like this and then come down toward the CEJ or toward the crown like that. So whether it's a shallow pocket or shallow area or something deep like this, if there's calculus right at the distobuccal line angle, this is a technique you can use to remove that residual calculus.